There's no easy way to say this, but you have cooties. I swear. That sometimes that's literally all that comes to head. Comes to mind. It's like, you know, this patient just has cooties. It's a true medical term, actually. Benadryl, you can't sneeze if you're unconscious. Oh my God, that is so true. That is so true. I mean, I can't take Benadryl personally because it just knocks me out, man. That's actually pretty funny. When your patient denies any medical history that shows you their meds. Oh my God, what makes these memes so funny is they're so true. You know, I talk to patients all the time and I'm like, yo, tell me what your past medical history is. You know, anything major going on, like diabetes, heart disease, kidney, liver, lungs, anything? No. And then I'll ask them, all right, well, what about your past surgical history? And they're like, oh.
Well, you know, I had 4 stents and a triple bypass and total hip replacement and yeah.
And you're like,
oh, and then don't forget the chemo.
Never fails. Literally never fails. My anatomy exam, identify this nerve. Oh my God, it's another one that's so true. I mean, especially like the nervous system is just so complex, and there's a nerve literally for everything, and inevitably you will be asked on an anatomy exam, you know, this one little nerve, you know, whether it's cranial nerve or whatever, but they'll be like, what nerve is this? And you're like, I have no idea. I have no idea. Dr. Mike, I'm afraid your condition is getting worse. Patient, does that mean I'm going to die? Dr. Mike. Pew. So cute. You're so cute, Dr. Mike, if you're watching. Oh, all right, so this isn't really a meme. It's just a cake that's actually made to look like a hand with an IV in it. I would love that cake. That is my cake. I need that cake, actually. Somebody send me that cake. I love it. When the immune system sends the body into anaphylaxis over a peanut antigen. We did it, Basophil. We saved the body. Oh my God, it's so true. Like everything's just burning around it. It sent somebody into like complete anaphylaxis, and you know, basophils are a type of white blood cell, and they're the least common type of granulocytes actually, and they only represent about 0.5 to 1% and of the circulating white blood cells, but that's truly like these tiny, you know, little cells, and everything's just burning down around it. So you're allergic to Tylenol, but not Percocet. I've had patients say this to me. As a matter of fact, just recently, the reddening and skin rash and blisters that people can actually get with Tylenol. You can actually have an acetaminophen allergy, but you know, you can also have an allergy to morphine. You know, morphine can release histamines, and anaphylaxis, true anaphylaxis to morphine is actually not that common, but inevitably, you know, somebody will have a little nausea, or, you know, it can cause that itching due to the histamine release, and they're like, I have an allergy. And 9.5 out of 10 times, I'll be like, all right, well, what happens when you take it? And they're like, well, it just doesn't agree with me. You know, very rarely will I have somebody say, oh, I go into full-blown anaphylaxis. And then I'm like, all right, no problem. But it's usually it makes me a little nauseous, or, oh, my skin gets itchy, or something like that. You can't be fake sick with me, mommy's a nurse. Yeah, my poor kids. My poor kids. I mean, yeah, they could never be fake sick. Nursing students, while that's correct, it's not the most correct. Oh, if there was ever a truer statement, I swear. I don't know, again, medical students out there or doctors out there, tell me if this is the same for you, but nursing exams are just, you'll have 4 correct answers and you'll be like, well, all of them are correct, and you'll be looking for some little nuance of something, and they want you to critical think, so they just give you barely just enough information to make a decision about something, but it's always just missing that one thing that would push you over the edge. And again, all answers are usually correct in some capacity, but we are to come up with the most correct answer. Yeah. It is crazy making. It is like, who does that? Who does that? Trying to explain your work schedule to friends. Yeah, it's 3 12s and then I'm off, and then I go back in that morning and then I'm off for like 4, and it's, what do you mean my sodium level is elevated? Oh, isn't the name of this character from Star Wars? Jabba the Hutt? Is it Jabba the Hutt? I think it is. And let me tell you, that's another one that is so true. I mean, denial is not just a river in Egypt. I've had patients that look just like that, and they're like, I don't know why the doctor's admitting me. I'm fine. So is it broken? Oh, I'm sorry, I'm not allowed to say. Yeah. We've all been there. I've been there. You break a bone, or a patient breaks a bone, and it's clearly broken, and you're in radiology and you're like, well, what does it show? Is it broken? And they're like, sorry, not allowed to say. Meanwhile, your hand's in like 8 different directions, and it's broken. Yeah. Oh, she's got, what does she have in her hand? It's supposed to be an IV, but it's actually a drip chamber to an IV, like a saline bag or something like that. It's the top of a drip chamber to, yeah, no. What show was that even from? Not good. Whoever is consulting on this show, shame on you. That is a drip chamber taped to her hand. I'm insulted. Yes, I charted that. I charted what I previously charted. Wait, hold on. I have to chart that I told you about my charting. Yes, that is actually true. I mean, in nursing school, and I think pretty much across the medical profession, they drill into your head, if it wasn't charted, it was not done. Literally, you live and die by that. And yeah, that's a perfect example of this. Somewhere in America, there's about to be an ER nurse with a great story to tell. Oh my God. Yeah. I mean, I do a lot of driving, and I've never seen that, but I've seen some crazy stuff. Or my son used to have a t-shirt actually that said, the quickest way to meet my mom is to say, hold my beer and watch this. And yep. Yeah. Hold my beer and watch this. That's another one. Another famous one. Like, what were you doing before this happened? Well, he told me to hold my beer and watch this. Yeah, that's the look you give when someone says, it sure is quiet. Oh God, that is literally enough to strike the fear into the hearts of everybody in the hospital. I've made the mistake of saying it, and paid for it for the next 4 or 5 hours of my shift. It's always around 3 a.m. and I would remember it being just, you know, so still, except for maybe the beeping of the monitors, and you were thinking it, but you never wanted to say it. You never wanted to be like, wow, it's nice and quiet, because you would literally get daggers thrown at you. Like that is the ultimate worst thing you could say in a hospital, on any unit. Doesn't matter. ER, ICU, CCU, pediatrics, it does not matter. Never utter the Q word. Ever. Night shift nurses at 6 a.m. You're ready for a report. Yeah, Beetlejuice. Yeah, I've been there too. I remember, like, when I worked night shift, I would hit a point where I was so tired that, like, my ears would start to ring. Like, I would get this, like, weird, like whirring sound in my ears that was like, I don't know, it always kind of worried me a little bit, but I'll never forget that. And then, like, inevitably somebody would do like a coffee run, and, you know, everybody would kind of kick back into gear and be running around, you know, fueled for the last part of your shift. But 3 a.m. was the worst part for me. That seemed to be when I was just like struggling. The struggle was real. That 3 a.m. witching hour, man, just the worst. Registered nurse, what my friends think I do, what the hospital thinks I do, what Hollywood thinks I do, yep. Society thinks I do, what I think I do, and what I really do. Okay, so yeah, this is kind of accurate too. You know, my friends, well, not my friends, but nowadays, especially with travel nursing and all of the information that's coming out about what salaries are being paid and hourly rates are being paid to travel nurses. You know, a lot of people, they hear you're a nurse and they're like, oh, you're in it, you're rolling in it. Okay. Then, you know, this is saying the hospitals basically think you're, you know, in the hospitality sector rather than the healthcare sector. Yes, and then there's the cans, what Hollywood thinks I do, which is the sexy nurse and the on-call room hookups, and, you know, we're multifaceted. We do all of this technically. Maybe not I don't know. I'm just gonna shut up now. But the end part of that is the charting. A lot of charting. There are times where you'll have, you know, just so much charting that it extends your shift by an hour. So what do you think? Oh, this is what from Scrubs? So what do you think, Prairie? There's a light bulb. This guy has a light bulb up his butt, where the colon has a great idea. That's awesome. It's great. Have a good night. I'm gonna go laugh at more memes.